Hello, this is Lynn Fabia, and I'm here talking with Dr. Peter Hofmann, and we're talking about his second book, Dentistry Exposed. It was published in November of 2019. Dr. Hofmann is a practicing dentist with 43 years of experience, and he practices in North Dallas area?
Yeah.
Okay, so this is interview number 6, and we have a couple of more, and we're going through the book and really pinpointing some very interesting information. You wrote that patients who are weakened by radiation therapy and cancer have low immune response. This is a good reason to have a loose or highly infected tooth, or any of the problems they're having, they should have it taken care of prior to the chemotherapy.
Right.
And why is that?
Because if it does become infected more so, it will have to be pulled, and to extract the tooth after radiation can cause radionecrosis, which is very difficult to treat. Antibiotics don't treat it. So you want to pull all bad teeth before having radiation therapy.
I wonder if they tell them that.
Oh, they do typically.
Oh, do they?
They'll pull all the bad teeth. You should have them all pulled, just in case. You just don't know which particular tooth might blow up and cause a big problem.
Mm-hmm. And if they have a recent joint surgery, they should take antibiotics prior, just do a cleaning.
That's true. And it's called a prophylaxis. That's what I thought you were getting to. The antibiotic regimen taken is called a prophylaxis, and a cleaning is called a prophylaxis. So yeah, you want to have a prophylaxis of antibiotic prior to having your cleaning done, your tooth cleaning. Because if you don't, the gum tissue that's swollen, or even healthy gum tissue, if it's got bacteria around it and it is irritated to where it bleeds, you can get the enzymes and the bacteria, the bad bacteria, into your bloodstream, and that's what affects the heart. They used to think heart disease and the enzymes they found were from the liver. Now they realize it's from the human mouth. And P. gingivalis is one of the bad bacteria that can affect blood vessels, weaken them. That can get into the placenta and the amniotic fluid and affect the baby, causing preterm birth. It can cause pancreatitis. It can cause a lot of inflammation elsewhere in the body.
The forces that cause wear and tear in your mouth are related to grinding or clenching of the teeth. But also you say, a lot of people do this, I used to, chewing ice, hard food or candies can break or erode the teeth.
Yeah. That's, ice is pretty effective at breaking teeth. Just chewing on, a lot of people say, oh, I just chewed on a cookie. Well, you may have noticed the cookie broke it finally, but it was probably cracked earlier than that.
Your tooth.
Yeah, and a lot of people crack weak teeth on carrots and almonds and things like that.
That's true.
But yeah.
Carrots are
pretty tough.
Yeah. It's something to think about.
Popcorn is probably the number one. Kernels, little kernels break more teeth than anything. Yeah.
Just had popcorn yesterday. Okay. Teeth can die by hard impact or calcium buildup. However, a dead tooth can be saved with the root canal and crown.
Yeah, root canals, what a root canal does is it removes the necrotic tissue that's dying inside the tooth. You have to get rid of that, or else an abscess will form. And if a tooth totally calcifies, which happens, but not very often, you don't need the root canal, but that does not happen very often.
You yourself used to have personal problems. You had this consistent hacking cough, you said, and then continuous strep throat in your life. And you would take, like everybody else, antibiotics, penicillin, and it would be a continuous merry-go-round. You would take the same thing. But you're saying better to avoid overuse of all antibiotics. Use xylitol spray. Where can you get that xylitol spray?
Well, you can buy it at pharmacies. It's pretty available, or you can make your own. I make my own. I just use a little xylitol and water. You can use distilled water or saline solution, and you just make it in a little spray bottle you can buy at at a little drugstore, little homeopathy center.
Right, the brown amber bottles.
Yeah, and you just spray that in your mouth whenever you need to. Now, my cough, my dry cough was intermittent. You know, I would typically get it in the winter, flu season, and that's this kind of thing. And same thing with the strep throat. But I would use that antibiotic, penicillin, which takes a while to work. It takes 48 hours. It has to go from your stomach all the way up to the head and through all the layers, whereas you can just spray directly and it stops the bacteria.
So you're
Cold.
saying you took xylitol like from the sugar?
Xylitol sugar, the bacterium, I explained this in one of the earlier interviews, but I'll explain it a little bit better. The bacteria eats 6-carbon sugar. It's like a wheel with 6 teeth. Xylitol is a 5-carbon sugar, a wheel with 5 teeth. When the bacteria eat the xylitol, they get jammed up. They can't produce acids. They let go of the tissue that's inflamed, and therefore then the tissue no longer is inflamed. But at the same time, the xylitol instigates the production of fluids. It's what we call hypertonic. So it draws fluids, saliva in the mouth, in the gut it'd be other fluids that would help the flow of food and prevent constipation. In the mouth, it's saliva, and that then you swallow it. So you're getting rid of the bacteria without even killing it. You're just protecting the good bacteria, but getting rid of the bad bacteria that are the
Which
heavy.
is different from antibiotics, which
Right. Everything.
takes everything. You need that bacteria to help you, to keep your immune system strong. It wipes it out.
And it wipes out the good bacteria
That's
in the
exactly.
gut too.
When we need that
In the gut.
to keep
yeah.
our immune system strong.
And mouth. Yeah.
Oh, okay. So you can make your own, or you can buy it at a pharmacy.
Mhm.
The xylitol spray.
Yeah.
Xylitol also helps I keep reading about all these miracle things that it can do. It helps to strengthen your bones. So chewing gum with xylitol, how does that help?
Well, it does 5 things in the mouth. I mentioned 3. It stops the bacteria from producing acids. It washes them away. It detaches them from the tissue. But it also keeps them from reproducing at the same time. And also what it does is it stimulates the growth of bone, because the xylitol has it's a triple ligand. So it has the ability to lose 3 OH groups, and it can grab a calcium, which is a +2. So it grabs the calcium ion loosely that's in the mouth. Your saliva has a lot of calcium in the saliva. So what happens is it grabs that calcium ion and it takes it to the tooth. And it can recalcify teeth and it can recalcify bone. It can do both. So it does a lot in the mouth. Whereas there's no substance like it. It's like a sugar. And so that is why even the FDA doesn't really call it a sugar, even though it is. They allow drugstores and grocery stores to say sugar-free when they describe it.
Oh.
Isn't that amazing?
Yeah,
it's actually
a plant-based substitute for sugar, I read, but it's in our bodies already.
your body produces it. Your body produces 15 grams a day.
Mm-hmm.
The recommended dose into your mouth is 15 grams for an adult. So you can take more, I take more, but it might make your bowels a little looser.
Because you're taking.
Especially if you're not used to it.
Yeah.
But I'm so used to it, I can take 20, 25, 30 and it won't affect me at all.
But for the people, they should do everything gradually.
Gradually, you want to do it gradually.
Always.
Definitely.
Well, this has been very interesting. We will see you next week, and we'll take up with, we'll start with interview 7.
Thank you, Lynn. Oh, I did want to mention one more thing.
What is that?
Because the xylitol goes in the gut, it also stops candida and helps to prevent colon cancer.
Oh,
That is really key.
that is really key.
So
Thank you,
thank
Dr.
you.
Hoff.